and welcome back to this series where we're talking about the United Nations High-Level Meeting 2025 and the advocacy priority areas that the NCD Alliance, in collaboration with the Non-Communicable Diseases Global Community, has set to be presented at the United Nations High-Level Meeting. My name is Ogweno Stephen. Let's roll. The second advocacy priority area that the Non-Communicable Diseases Alliance has set for the United Nations High-Level Meeting 2025 is breaking down of silos. This is to ensure that we're able to bring the NCD agenda to the center of global health and development agendas to work in collaboration with these different actors to achieve more together through integrated action. Whether someone becomes healthy or not is not a matter of personal choice, though personal choice does play a role. However, it goes much more into the environment, and therefore developing healthy lives and becoming much healthier is as a result of the environment, is as a result of the community, is as a result of the poverty levels, is as a result of the implemented policies. And this is why we are saying that NCDs are a poverty issue. They are a human rights issue. They are an equity issue. And without these components being looked at in conjunction with the NCDs agenda, then we are still limiting the potential of what could be achieved by addressing all of these actions together. And this is why we are calling for this breaking down of silos and bringing together of these different global actors to act on NCDs. Along these lines, the advocacy asks that the NCD Alliance, together with the global NCD community, are bringing to really address this agenda of breaking down silos is first to ensure that non-communicable diseases are fully integrated into the local, national, and international development planning tools and authorities. This is to ensure that at any given point and for any given plan, that the NCD agenda is not forgotten and that it is integrated in these plans. We are also asking that people living with non-communicable diseases be recognized as a vulnerable population across the United Nations. This is to ensure that these people get the services that they require to lead an improved life over the long term. We are also asking that non-communicable diseases be integrated in the universal health coverage plans and packages to ensure that these communities of individuals living with non-communicable diseases are fully covered and they do not have to suffer from out-of-pocket costs and expensive health medication that goes over the long term after developing these diseases. The next key ask is really asking governments across the world to develop policies that look at eradicating the social and economical determinants of health. If policies existed and were implemented that ensured that the social and economic determinants of health were dealt with, then we'll see a rise in more healthy populations and a reduction of deaths and suffering caused by non-communicable diseases. Because as I stated earlier, you being healthy or not is hugely contributed by the environment in which you exist and operate in. The next key priority area along these lines is also to ensure that the already strong developed infrastructure in the maternal and child health, in TB, in HIV and AIDS, be integrated with NCDs to ensure that care is brought across all of these different divides. Instead of operating in these focus areas as silos, we want a convergence, we want a merging of these silos to ensure that whilst we are addressing maternal and child health, we are addressing NCDs. Whilst we are addressing TB, we are also addressing NCDs. Whilst we are addressing HIV and AIDS, we are leveraging on those structures and existing systems to also fund and address non-communicable diseases. Finally, to really drive the point home, the NCD Alliance is also calling for the inclusion of NCDs in pandemic preparedness, prevention, and response actions in food systems and nutrition and in planetary health. When COVID-19 happened and many pandemics are coming through and will come through, we want to see that NCDs care is integrated in those services. We want to see that the food systems and nutrition and action around improving food systems and nutrition have NCDs squarely integrated in those services. And finally, when it comes to planetary health, we recognize that the drivers of climate change also affect non-communicable diseases. For instance, if there is increased air pollution, we see a rise in chronic pulmonary diseases amongst other NCDs. If there is more UV rays in the ecosystem, we see a rise in skin cancers. If there is a rise in drought, we see a reduction in food availability, and as a result, more consumption of unhealthy diets and a rise in non-communicable diseases. These things are connected, and that is why the NCD Alliance is really proposing for integrated action. Let's do these things together. Let's not operate as silos. This is the second priority that the Non-Communicable Diseases Alliance globally and the global community of people living with NCDs has put together to ensure that action is implemented and to ensure that we have positive results of the 4th United Nations high-level meeting in 2025. My name is Ogweno Stephen. See you on the next one.